Wildland fire operations are inherently dangerous. We frequently work in remote environments with near-constant hazards. Everything we do on a fire line carries with it some level of risk. Because of that, we plan our actions to minimize or at least mitigate risk in order to keep each other safe and prevent injuries. But on the fire line, injuries can and do happen. If someone is injured on the line, you can take action regardless of your level of training. Pull out your IRPG and turn to the Specific Treatments page in the medical section. Let's go over a few injuries you could see on a fire line, and what to do if they happen. First things first. If there is a chance of coming in contact with blood or any other bodily fluids, always use appropriate personal protective equipment, such as gloves. For bleeding, apply direct pressure with bandages. You can also use a pressure dressing, which is bandaging held in place on top of the wound with tightly wound gauze or cloth. While wrapping, twisting the dressing directly over the wound will increase the pressure. If you can, elevate the affected area so that gravity pulls blood away from the wound. For life-threatening bleeding on an arm or a leg that cannot be controlled with direct pressure, use a tourniquet. A tourniquet should be applied above the wound, but not on the wound itself. Typically, about an inch above the injury is ideal, but you can go higher if you need to. Do not place a tourniquet over a joint. Get it as tight as you can with the Velcro strap before cinching it down with the windlass. If you can, write down the time the tourniquet was applied. That information will be helpful in continuing patient care. Shock is a severe drop in blood flow that can cause injury to vital organs like lungs, kidneys, and the brain. It can be caused by a variety of factors, like bleeding, dehydration, overheating, or even allergic reactions. Shock is always a life-threatening emergency and should be treated as such. If you suspect a head or spine injury, do not move the patient unless it is absolutely necessary for their safety. Until the patient can be transported to the next level of care, lay them face up on the ground. It is best to lay the patient on a flat surface so they are in an anatomically correct position. If you are on a slope and other crew members are nearby, some of them can dig a cup trench to create a flat surface. If possible, place something between the patient and the ground to insulate them. Once the patient is in position, elevate their legs to help direct more blood toward vital organs. Use your emergency blanket or whatever you have available to keep them warm. Tuck the edges underneath the patient to maximize insulation. For a fracture, first check the patient's CSM, circulation, sensation, and movement. You can check for circulation by squeezing an extremity and watching to see if blood immediately returns, which is indicated by a normal color returning to a finger or toe. Check to see if the patient can feel your touch and that they can move the extremity. The absence of sensation or movement may indicate nerve damage. In either case, splint the injured limb, making sure to splint the joints above and below the injury. You can use manufactured splinting tools or whatever you have available. When possible, include padding for comfort and stability. Check the patient's CSM again after splinting to make sure the splint is not restricting blood flow. For a head injury, it is better to have two people. One person should hold the patient's neck in place while the other carefully removes their hard hat. Then, stabilize the patient's head and neck to prevent further injury. Make sure their airway is not constricted. Do not move the patient unless it is necessary to ensure their safety. Wait for help to arrive. Some people are severely allergic to bee and wasp stings and can go into anaphylaxis, which is a life-threatening condition in which their airway swells to the point that they cannot breathe. Epinephrine, another name for adrenaline, can be injected if necessary. If the patient has an epinephrine auto-injector, commonly referred to as an EpiPen, you can assist them. The lateral aspect of the thigh is the easiest place to inject. First, empty the patient's pockets to ensure nothing is blocking the needle. Hold their clothing tight against their leg and allow the patient to self-administer. You may also assist the patient with an inhaler if they have one. For burns, remove the patient from the heat source or the heat source from the patient. Cool the burned area with water immediately and loosely wrap it in a dry dressing. Do not wrap too tightly to avoid doing further damage. Encourage the patient to drink more fluids, as serious burns can significantly dehydrate you. If someone gets debris in their eye, have them lay on their side with the affected eye on the lower side. If eye wash is available, use that to flush out the eye. Otherwise, you can use drinking water. Heat stroke is a life-threatening condition that calls for immediate evacuation. It is critical to cool the patient down as much and as quickly as possible. Put the patient in the shade, remove some of their clothing, and pour water over their neck, head, and torso. Fan the patient to generate some evaporative cooling. Wildland firefighting is a dangerous job in a dangerous environment. We rely on ourselves and each other to stay safe, but the risk of injury is always there. If someone gets hurt in the field, you can help them even if you only have basic medical training. Just use your IRPG. You might even save someone's life.